so much for inviting me. I feel really, really privileged, and I was asked if I needed access to PowerPoint. I decided no, there was no need. I could give you some boring numbers, schizophrenia, 1% of the population, borderline personality disorder, 3%, depression, at least 40% people, sooner or later will have some symptoms of depression. That's not important. You can always find it online. Few words about myself. Yes, I'm originally from Poland, so in Chicago I would be called Polak, which apparently here might have some derogatory term, but Polak in Polish means a guy from Poland. Originally I was trained in ENT, and then I switched to psychiatry, so occasionally I tell people that I'm taking care of the same part of the body, I just don't operate on them anymore. And the advantage of being a psychiatrist, I can be half blind, one arm, a little bit of dementia, and I can still work. And I'm a workaholic, I want to work until I die. I want one day people to say like, I saw him yesterday and he looked pretty good. What now, if I had known about Baxter community 25 years ago, I would have moved here from Louisiana directly, but somehow I ended up in Batesville. And Batesville is a great community too, but Baxter is hands down. Don't tell him in Batesville. Much better. I came here 4 years ago, 2019, almost 5 years ago, hard to believe. And I expected some honeymoon and being treated nicely here for a few weeks. Guess what? For almost 5 years, and I've been treated very well here. So this is a great community, absolutely great. I understand that people are moving from Montana and other places. One thing before I forget about smoking, I don't smoke for the record. But almost every time I offer a nicotine patch to a patient of mine at the time of discharge, and they refuse, I say like, well, right now you're 25, but imagine yourself when you're 55 or 60 with COPD and lung cancer and so on. So I'm doing my part to convince people to quit smoking. Well, in 2019, I came to the adult behavioral unit, and Dr. Foster, I believe, was running the geriatric unit, so we were just doing this together somehow. And then I think around 2022, Dr. Foster moved to the VA system, so I was asked if I could take care of both units, geriatric and adult. It's a challenge, but I like challenges in life, so I agreed, and no regrets whatsoever. It keeps me busy, but I get some help. We have 2 nurse practitioners, skilled nurse practitioners, who are helping me, so this way we can manage somehow and take care of everybody. My heart is with the geriatric population, I admit. I like really geriatric psychiatry. I don't have to deal so much with personality disorder, with substance abuse. Of course, you can find it everywhere. So you can find an 85-year-old alcoholic or something of such nature, but it's not as much as adult unit. On top of this geriatric unit, I have more time to provide my service because they stay with us for 6, 7, 8, 9, 10 days. Adult population, unfortunately, it's a revolving door. They just come one day, and usually within 72 hours they are discharged. Some of them try to be discharged on the same day, and I try to explain to them that it doesn't make any sense to come to the hospital for just a few hours. We are not an outpatient clinic. When it comes to the adult population, overwhelmingly, I am dealing with symptoms of depression, anxiety, and although technically we are not considered a dual diagnosis unit, a huge percentage of the population is dual diagnosis. I see unbelievable amount of methamphetamine, alcohol problem, and so on. When it comes to marijuana, I know that it's legal now for so-called medicinal approach. As a physician, I absolutely disagree with this. I don't care if it's legal or illegal, I don't recommend it. I mean, if I had somebody who is 85-year-old with a terminal cancer and marijuana is the only thing that can help, sure, absolutely, I can understand. But otherwise, I had a simple test for my adult population. And I don't know any specific numbers. So I asked, like, what would be your estimate if you are just walking on the street and you see 10 random people? How many of them would be positive for marijuana? And they give me different numbers. Some people say 3, some people say 5. I said, okay, I don't know the number, I will take it. Now I can share with you my number, that close to 90% of the people who come to the adult behavioral unit with psychiatric problems, depression, anxiety, and some other problems and so on, are positive for marijuana. So how come is it so good for us? Everybody should be relaxed, just smoking the old fashioned, watching TV and so on. I mean, it's great. Yeah. So that's my point on marijuana. Our patients are seen both at the adult unit and geriatric unit on a daily basis. I work presently 4 days a week, Monday through Thursday, I see them. And then on the weekend and Fridays, whoever is on call, I am on call like every 4th week. We are presently looking for more nurse practitioners to help us. Psychiatry is not much different than other branches of medicine, so I know that radiology is desperately looking for more providers. In psychiatry, there is also a shortage of providers, so that's everywhere. By the way, before I forget, my stepdaughter is doing radiology residency, so she's planning to stay in Arkansas.
Can I get that number?
We had another psychiatrist with us, but Dr. Zach, she moved and now she's working outpatient, I believe with AR Care, which is great that she's still in the community, so she's available. Our patients, when it comes to adult population, occasionally they have slightly unrealistic expectations what we can provide for them, but we try our best, and overwhelmingly they are leaving the unit much more happy and doing much better than when they come to the unit. Again, the majority of them are depression, anxiety. Occasionally I see bipolar disorder. Schizophrenia is not as common as you think. As I mentioned before, it's 1% of the population. So we occasionally see such patients. And actually they are my favorite patients, to be honest. They are much more predictable, and if people are afraid of somebody with schizophrenia, I say I'm much more afraid of people with no schizophrenia rather than with schizophrenia. Because if they are treated appropriately, if they are on the right medication and so on, then we don't have any significant problems. Geriatric population is somewhat different. Overwhelmingly, I am dealing with what used to be called dementia, and now politically correct, it's called major neurocognitive disorder. So a bunch of words, basically it means exactly the same. So this is our #1 probable diagnosis when people come to the hospital. Of course, they don't come for dementia itself, because dementia is not an acute condition, so they don't need to be in a hospital. They come to the hospital because of dementia with, and you name it, behavioral disturbances, psychotic thought process, depression, anxiety, agitation, insomnia, you name it, and so on. And then after depression, of course, comes dementia. We see some depression, we see some anxiety and some other problems. Roughly, this is divided 55. So anybody under 55 is considered adult population. Everybody above 55 is geriatric. I, again, disagree with this division because I'm 64, almost 65. And hell, I don't consider myself geriatric whatsoever. When I look at the mirror, I say, like, who is it? And what did you do to my body? Because in my mind, I'm still 25 and I can do strange things, including skiing, riding a motorcycle, and so on. Average stay, as I mentioned, adult population about 3 days, 4 days, 5 days, occasionally a little bit longer. Geriatric population, usually we say between 6 and 10 days. Of course, some people are ready to go after 5 days. Some people stay with us for 2 weeks or 3 weeks. A significant issue frequently is placement. So people come to us, geriatric population, and either they don't have a place to go because they have been at home neglected or homeless or whatever happened and so on, the family is not able to take care of them, or they came from a nursing home facility and the nursing home facility says, oh, we cannot take them back. So this occasionally takes some time. Another issue is legal status. So adult population, overwhelmingly, these patients come to us on a voluntary basis. Obviously, they are oriented to themselves, place, time, situation, so they can provide informed consent. Sporadically, we have someone who is on a so-called 72-hour hold, involuntary commitment. In Missouri, I believe it's 96 hours, and we cannot take somebody from another state based on a short involuntary commitment. So when it comes to geriatric population, frequently somebody else is needed to represent them. And unfortunately, it's not up to me, because if it was, I would have made it, if I were a government, then I would have made it that everybody who is over 18 should appoint another adult person to be your legal representative just in case, power of attorney. And people are afraid of this, like power of attorney. I'm giving all my power to another person, which is not true. I've got a power of attorney for years, and they don't dare to tell me what to do or not to do. It happens only if such person loses ability to provide informed consent decision, make rational decision, and so on. And it could be on a temporary basis. You know, somebody is in a delirium process and is not able to make rational decision, and then 5 days later you're fine and you are back to yourself and so on. So I would highly recommend in the community to suggest appointing somebody durable power of attorney. And from my point of view, we don't care about the financial, but we do care about medical. So medical power of attorney, durable power of attorney, very simple process. Anybody can find a 1 or 2 page. Don't go to lawyers and get those 15 pages of power of attorney. That's not needed. Very simple form. And then preferably notarized. I know that not notarized with 2 witnesses is still considered valid. I prefer if it's notarized. So, and this would help everybody. This is more or less what we've been doing on a daily basis. So I would be more than happy to answer your questions. I'm open to suggestions. If you know any psychiatrist who wants to work with us, he or she is welcome. We are looking for another nurse practitioner. And people ask me, so when are you going to retire? And my answer is never.
All right. Thank you very much.
Thank you.